move on to the last part, the nerves, dividing into two parts, the cervical plexus, and then we will be discussing the sympathetic chain. Just like you discussed this, you know about the plexi present in the rest of the body. In the upper limb, we talked about the brachial plexus. In the lower limb, there was lumbar and sacral plexus. Similarly, there is a one for the cervical region. It is the root value. It is coming from the anterior MI C1, C2, C3, and C4. They are mostly coming from this. C5 onwards is part of brachial plexus. The other part is their location in terms of muscles. It is between anterior and middle scalene. It is between two scalene muscles, anterior and middle scalene muscles. So it is anterior to the middle and posterior to the anterior scalenus muscle. The fact that it is coming from anterior rami, that is true for all plexus. That is true for all plexi. Then there is a talk about the Ansa Cervicalis. We will go into the little more detail here. There is a loop hanging down that is having the anterior downcoming limb, posterior upgoing limb, not upcoming downgoing, but anterior limb and posterior limb. This is the Ansa Cervicalis. We will talk more about it in just as we follow the other branches, and it supplies majorly the muscles of the neck, this cervical plexus as a whole. Ansa Cervicalis majorly supplies the infrahyoid muscles. That are four muscles that are present there. Let's see the branches. The cervical plexus, it has, first let me show you through the back picture again. If you notice, this is the nerve, that is hypoglossal nerve, going through the head and neck, going to the tongue. As the C1 fibers branches from the brachial plexus, they exit, and you may not see the C1 branches going elsewhere. C1 branches are just entering the hypoglossal nerve. So they are not distributed by themselves. They get into the hypoglossal nerve and get a piggyback ride into the different regions. It goes through the hypoglossal nerve to the genioglossus, goes through the hypoglossal nerve to the thyroglossus, and even the anterior ramus, that is supplying the infrahyoid muscles. So the anterior limb of the Ansa cervicalis, that is supplying the infrahyoid muscles, that exits through the hypoglossal nerve. So when talking about the hypoglossal nerve in the cranial nerves lectures, you may come across the sentences like hypoglossal nerve supplies the genioglossus and thyroglossus muscles. Hypoglossal nerve supplies the infrahyoid muscles through anterior limb of Ansa cervicalis. Just keep this thing in mind that all of these supplies, these are from actually from C1. Nothing will happen to these muscle if there is isolated damage of the hypoglossal nerve nucleus in the brainstem. So, and it is very wonderfully, beautifully shown by this picture of netter hair through this red line. So, this is about the Ansa cervicalis. This is the branch, C1 branch, that is going to C1. It becomes a part of hypoglossal nerve to the two muscles, genioglossus, hypoglossal, and the superior root, the anterior root of the Ansa cervicalis. It is coming from hypoglossal nerve. And this is, and then we are left with the posterior inferior root of the Ansa cervicalis. It is coming from two nerves, two roots, C1 and C2. They join, and then they form the inferior posterior root of the Ansa cervicalis, and this go on to supply the infrahyoid muscles. Then there are the muscular branches. We are done with the infrahyoid muscles, the front of the muscles in the front. Then the muscles are left with the prevertebral muscles, anterior group and lateral group. Anterior group included the longissimus coli, longus capitis, and rectus capitis anterioris, lectus capitis lateralis, and on the lateral aspect there were scalenus anterior medius later. All of these muscles are supplied by cervical plexus. Their branches are not shown here, but direct branches from the cervical plexus, the anterior ramus, the direct branches go to the nerves. Their direct branches go to the and direct branches go to the those muscles. And so even if you have reading the origin insertion tables of Snell and KLM, you are reading the tables. you won't see the named nerves. You will just see the C1, C2, C3, C4 as they are supplying the segmental nerves. Then there is phrenic nerve. That is a bigger one and important one. It is shown right here. You maybe say they have taken care to make the C4 root larger as compared to the C5 and C3. C5 and C3 are giving the minor roots, and the major contribution is coming from C4, and it will go down. Very important MCQ point, that it runs anterior to the scalenus anterior muscle. It is on the way, it is embedded in which fascia? Prevertebral. It is embedded in the prevertebral fascia, and it moves down anterior to the subclavian artery, and it moves down all the way down to the thorax, and the rest of the supply and the root will be discussed in the thorax lectures. Then the sensory nerves. The four main sensory nerves that have been discussed in the previous lecture with the neck, skin of the neck, and they have been discussed in the this today's lecture while talking about the relations, when talking about the contents of the posterior triangle, and when talking about the posterior relations of the sternocleidomastoid. So these were the four muscles nerves. So there was two going upwards, one going horizontally, one going down. The one going downwards, the supraclavicular nerve coming from C3 and C4, they will further divide into medial, intermediate, and lateral branches. Medial one will go all the way to the midline at the angle of Louis. Intermediate over the pectoralis special up to the rib 2. Lateral one will go into the lateral aspect and back of the shoulders over deltoid muscle, upper half of the muscles, and on the back up to the level of spinoschapula. Then there is transverse cervical nerve. It goes transversely in this direction, superficial to the sternocleidomastoid, to the anterior of the neck, and it will supply this whole area from the chin all the way to the jugular notch. These are the supraclavicular nerve. These are the transverse cervical nerve, chin to manubrium. And then we are left with what? The nerve that are going upward direction. These are two, lesser occipital and greater auricular. Lesser occipital will be the one that emerges from the tip of the um, posterior triangle, and it will go at the back of the ear all the way to this area. So it will supply the skin behind the ear and the skin on the medial aspect of the external pinna. Greater auricular will, on the other hand, this is sternocleidomastoid. On the posterior part of the sternocleidomastoid, this will emerge from here and it will cross sternocleidomastoid and come to the angle of the mandible here. So it will supply this area, and it will supply the lower half of the ear, lateral surface of the pinna, and part of the external auditory meatus all the way up to the eardrum also. So this is the greater auricular nerve. Then there are sensory nerves that are not so much in not so much high stakes, but you have to know them. For topic anatomy, we'll discuss everything. These are the meningeal branches. They will go up into the posterior cranial fossa and give it supply. You may have a memory of reading about them when talking about the meninges, the meningeal supply of the posterior cranial fossa. It was supplied by the cervical branches C1, C2, C3. It was supplied by the cervical plexus. So how do they go up? Some of them, especially C2, C3, they go by themselves. The branches, they go directly through foramen magnum into the posterior cranial fossa and supply them. Otherwise, they may get a ride from hypoglossal nerve in the case of C1, or the vagus nerve C2 and C3. Those nerves are coming down, so these fibers will go in upward. They will go along the nerves and they go up and get in the posterior cranial fossa below the tentorium cerebelli and supply these areas. Then there are proprioceptive fibers. If you remember from the yesterday's lecture, we discussed the origin, insertion, and supply and functions of sternocleidomastoid and trapezius. If you remember the table from the Snell in which the origin insertion was written, those the nerve was written accessory nerve, spinal root of accessory nerve, and branches from the cervical plexus and branches from C2, C3. So these are those branches. Those are not technically motor branches. These are basically sensory branches. The proprioceptive signals coming from sternocleidomastoid and trapezius, they don't go to the CNS along with their own nerve. They don't go to the CNS along with spinal accessory nerve. They go to the CNS through independent nerves that are from the cervical plexus, proprioceptive branches from C2 and C3, C4 and C5, C3 and C4. Not shown in this particular picture. They may have some motor fibers because it has been noted that after even the sectioning of complete sectioning of a accessory nerve in some people, there may be some motor movement present here. So this is due to this proprioceptive branches. So this is about the cervical plexus.